You're making great progress.
Through a simple video link at a health facility in Wadena, Minnesotans living in the northwest part of the state can access one of the Twin Cities' top orthopedists without traveling to Minneapolis.
One of my goals was to establish an outstate presence where we could make the commute a little bit easier for people, but yet do it in a way that we got very good medical care.
For the past decade, Dr. Dan Buss has been seeing outstate patients at Tri-County Hospital in Wadena using teleclinics. While they save the 3-hour trip from Wadena, many of his patients come from much farther in northwest Minnesota and the Dakotas.
How about straight up to the front?
Via a crystal clear video feed, Dr. Buss and the team are able to follow up and track the progression of patients as well as diagnose symptoms.
When we started this, I thought probably half the patients would say, I want to come down and see you in person.
I think it was working fine.
Yeah. It's been surprisingly well accepted with patients. Usually it'll be people that I feel I need to get my hands on that I have to talk into coming down here to see me.
In recent years, the University of Minnesota Medical School has taken the lead establishing telemedicine for rural communities, which have a wide range of medical options available via telemedicine, from psychiatry to cardiology to dermatology. This is especially important in fields beyond primary care where access to subspecialists is limited.
So by the end of the 6th week, done with the sling. All right?
The latest telehealth inventory was done in 2007 by the University of Minnesota, and it included 107 facilities with telemedicine abilities, covering the state from East Grand Forks to Grand Marais, Worthington to Winona.
Probably one of our biggest personnel hurdles was building the expertise in Wadena to do the exams and treat patients like we would treat them here.
Subspecialists like Dr. Buss, who work strictly with shoulder and elbow ailments, say they need a general population of a little more than 1 million people to fill their schedules. In a state with a total population of about 5 million, there will subsequently be few doctors like him.
In outstate Minnesota, there's very little access to subspecialization.